Hi, good morning, Colin. My name is Jamie Cage. I'm your invigilator for the OET speaking session on the 10th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Colin Smith.
And what is your candidate number, please?
My candidate number is 231202431.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How attached you'll get to your patients?
Despite all the dashing about, nurses still find time to grow fond of the people they care for. Before I became a registered nurse, I didn't know how attached you actually become to your patients and their families. Day in and day out, we care for so many different patients, but there will be special ones that leave an impression on our hearts. Saying goodbye to these patients can be difficult. But being a nurse means that, you made a difference in their lives, no matter how big or small.
How much critical thinking nurses do?
What surprised me the most, when I began working as a registered nurse is the level of autonomy that one may experience, even as a new graduate nurse. A lot of people mistakenly believe that nurses are there to follow whatever orders the doctors give us. While we also do that, nurses must also thoroughly assess a patient or situation, critically think and then implement the plan of care. This skill is so important that the Bureau of Labor Statistics, BLS, highlights critical thinking as the most important skill a registered nurses need for the job. A nurse may probably feel unprepared, but will soon realize that he or she actually knows more than they think and do.
Are hospital jobs competitive?
I didn't know it would be so hard to find a job as a new graduate. People were talking about the nursing shortage with a general impression that it would be easy to get a job. There certainly is a nursing shortage, but most hospitals have residency programs, hence accept only a certain number of new graduates. When you are a brand new graduate, keep your mind open to all kinds of jobs to gain the experience that will give you more opportunities. If one can't get to the hospital right away, consider other facilities.
How do you handle a busy shift or heavy workload?
Busy shifts are a regular part of my work as a nurse. I used to get overwhelmed when I had more to do than usual. But as I've gotten more experience, it's become easier to deal with. Taking a moment to meditate, or do my favorite breathing exercise, helps alleviate immediate stress. I've also been working on getting more comfortable asking for help, or delegating when I need it. I've worked alongside really wonderful people, who are usually willing to lend a helping hand, and who I'm happy to do the same for, when they're having a busy day.
How do you feel that you can help your patients?
I offer my patients the very best care and advocacy I can. I believe that I provide my patients comfort and confidence that they are being well cared for. I feel that my patients know that I am there to provide comfort, and understanding that I will listen to their concerns. I will act as their advocate if necessary.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
I beg your pardon. Can I have a name for the patient, please?
You are free to use any name. But make sure the name doesn't change until the roleplay ends.
All right. Thank you. I understand that.
No mention, please. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, Catherine. My name is Colin Smith, one of the nurses working in this community center.
Hi, Colin. Thank you for consulting me.
It's my pleasure. By the way, you seem to be very nervous. Could you please tell me what bothers you?
Nurse, my ear is quite painful.
Kindly do not panic, Catherine. From my examination, it seems like an infection. Well, for better clarifications, may I proceed with a few questions, please?
Sure, you may please.
Thank you, Catherine. Now, can you please brief me on the incident?
Sure, I had an ear piercing a week ago. And after that, the area became quite sore.
All right, for assessing your pain, could you please rate your pain on the scale of 0 to 10? Where 0 is the no pain, and 10 is severe pain.
Okay. I can rate it around 5.
Okay, noted. Do you remember any previous occurrences, or is it the first experience for you?
This is my first time experience.
Okay. Well, don't worry, Catherine. On my examination, and, from your words, I can confirm the presence of granuloma. A lump over the area.
Granuloma. Could you please explain it to me?
Sure, granuloma means a small fluid-filled lump. It is formed of cells to fight infection.
Okay. But how can you say it is not a serious lump?
A minor ear-piercing infection displays the symptoms such as redness, discharge, tenderness, and swelling, which resembles the infection you have.
Okay. So you say that there is nothing other than a common ear-piercing infection. Am I right?
Yes, you are correct.
Thank God.
Nevertheless, I have a very important point to be stressed. Please, do not remove the earring.
But why?
If a new piercing is infected, it is best not to remove the earring. Removing the piercing can allow the wound to close, trapping the infection within the skin. For this reason, it is advisable not to remove an earring from an infected ear, unless advised by a doctor or professional piercer.
Oh, I see. If it is not serious, then I could have applied the ointment I have at home?
I can explain it to you, Catherine. Most healthcare and piercing professionals caution against using alcohol, antibiotic ointments, or hydrogen peroxide, as they can irritate the skin and slow healing. Also, kindly avoid the use of antibiotics unnecessarily without a doctor's prescription. As of now, you just need to follow some of my suggestions.
Yes, please.
Firstly, you should wash the infected area 2 to 3 times daily, with warm salty water to heal infection. Try not to use perfumed toiletries, which may cause irritation. It's good to press a water-soaked cotton pad against the lump, which could relieve pain.
Is it necessary to consult a doctor to make sure whether these things are right or not?
No worries. Perhaps, usually, a minor infection of ear piercing can be treated successfully at home. But, if any of the following symptoms occur, seek medical attention, such as, the earring doesn't move. The earring clasp becomes embedded in your skin. The infection doesn't improve with home treatment within 2 days. If you develop a fever. And, if the infection, or redness, and inflammation, spreads beyond the piercing site.
All right. Let me do a self-evaluation before consulting the doctor.
That's great. Well, was the ear pierced by a professional, and done ethically with neat and hygienic equipment?
It seems to be sterile and was done with utmost care and professionalism. I don't think that could have resulted in the infection.
All right. A piercing is essentially an open wound. An earlobe piercing usually takes 6 to 8 weeks to heal. Cartilage piercings, which take place on the harder part of your ear, generally take longer to heal, and can be more prone to infection. There are several ways your ear piercing can get infected. Any bacteria left to fester can quickly turn into an infection. If you touch your piercing with dirty hands, or instruments, you can introduce an infection. If the earrings are on too tightly, not allowing room for the wound to breathe and heal, an infection can develop. A piercing can also get infected if there's too much handling of the piercing, or the post of the earring is rough. Are you understanding me?
Yes, I do. Well, I hope it gets better soon. Anyway, I will make an appointment with the doctor, only if there is no improvement in the next week.
That's perfect. Do you have any other concerns to be addressed?
No.
Great. I hope you have followed all my instructions.
Yes, I am clear.
Good. I wish you a speedy recovery.
Thank you. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.